Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Today I'm going to talk about a very important topic as far as the ENT is concerned, and that is acute and chronic infections of the nose. In that topic, we are going to cover not only acute infections, but chronic infections, as well as chronic granulomatous diseases of the nose. So please stay with me. Thank you. Bismillahir Rahmanir Rahim. Acute and chronic rhinitis. By definition, rhinitis is defined as inflammation of the nasal mucosa. Various types of rhinitis, we can subdivide that into two, acute and chronic. Now, classifying the acute type of rhinitis, we can talk about viral types, we can talk about bacterial, and in that classification, irritative as well. Now, the examples of acute viral type of rhinitis, the commonest example I can give you is the common cold, which is also called coryza. Whereas others in the same classification is influenzaal type of rhinitis and rhinitis with exanthemus. Whereas bacterial type of rhinitis, we'll talk about diphtheritic or diphtheric rhinitis. Talking about irritative type of rhinitis, among the acute ones, we've got rhinitis due to dust or smoke and fumes of irritating gases like ammonia, formalin, and acid fumes. Coming to the chronic type of rhinitis, we've got certain types, among which there is chronic simple rhinitis, there is hypertrophic type of rhinitis, there is atrophic rhinitis, rhinitis sicca, and rhinitis caseosa. Coming to the viral type of rhinitis, the first example, which is very important, since that is the commonest type of infection one can get in his life, is common cold, which is also called coryza. Its etiology is that it's an airborne droplet type of infection caused by viruses, while most common viruses causing it are rhinovirus, reovirus, coxsackie virus, adenovirus, respiratory syncytial virus, influenza virus, parainfluenza virus, mumps virus, measles virus. Now, the clinical features of common cold, that has got an incubation period of about 1 to 4 days. When the clinical picture starts, or the symptoms start, one starts to sneeze a lot on the very first day, whereas watery nasal discharge starts coming out, and there is sore throat, and there is nasal obstruction, and low-grade fever, and weakness, fatigue. That is usually followed by mucopurulent or purulent nasal discharge when secondary bacterial infection occurs after 2-3 days. The secondary bacterial invaders are Streptococcus hemolyticus, Staphylococcus aureus, Pneumococcus, Haemophilus influenza, Moraxella catarrhalis. Now, talking about the treatment of common cold, usually it doesn't need any particular type of treatment. Bed rest does a lot to get it better, whereas if someone has got a headache and body ache, analgesics help, and antibiotics are given when there is secondary infection, which is causing a problem to the patient. Talking about complications of common cold, it's usually a self-resolving infection. That's why we don't need to worry about it. But complications may arise in the form of sinusitis, pharyngitis, tonsillitis, and laryngitis. Now, as you can see in the picture, that somebody has made a diagram of a life cycle of the common cold there, and that shows on the day 1 there's decreased energy, scratchy throat, and nasal congestion, whereas on the day 2 and 3 there's sore throat, resolving sore throat, and the throat gets more congested and cough begins. Whereas on the day 4 and 5 there's nasal discharge thickening. That is usually due to secondary bacterial superimposed infections, and that causes post-nasal drip and pharyngeal secretions. Whereas on day 4-5, the patient starts to feel better as well, and perhaps he may sound worse too. But on day 6 to 7, one feels less sick, with some viruses, cough and stuffiness may linger on. Influenzal type of rhinitis. Type A, B or C influenza virus may cause common cold-like symptoms. And since it's a viral type of inflammation, it doesn't need any sort of antibiotics, but one may need to give analgesics and some bed rest. And if the influenzal rhinitis becomes worse or secondarily infected, one may need some antibiotics to cure it. Rhinitis may also occur due to measles, rubella, chicken pox. Secondary infection may complicate this kind of rhinitis as well, and that is treated accordingly. Talking about bacterial type of rhinitis, it is usually a non-specific bacterial rhinitis due to pneumococcus, staphylococcus or streptococcus that may occur in children. Whereas there is a special type of rhinitis which is diphtheritic rhinitis, and it is a serious disease one may talk about. Fortunately not so common these days. It presents with low-grade fever and blood-stained nasal discharge, serious infection with a dirty grey membrane formation in the nasal cavity which bleeds when tried to separate it from the underlying mucosa. Besides, exotoxins secreted by the bacteria make the infection life-threatening. Treatment of diphtheritic or diphtheritic rhinitis is usually isolation of the patient and diphtheria antitoxin, proper dose according to the severity of the infection, and antibiotics which can kill the diphtheric organisms. Talking about irritative rhinitis, an episodic type of rhinitis may occur due to exposure to dust, smoke and irritative gaseous fumes, which usually gets better when the irritating agent is removed. However, sometimes secondary infection may complicate this type of rhinitis as well. Talking about chronic type of rhinitis, we have certain types here, among which the simplest is chronic simple rhinitis. Now, sinusitis, tonsillitis, enlarged adenoids, dust, cigarette smoking, DNS, vasomotor rhinitis, etc. can all lead to the development of chronicity of an acute infection of the nasal cavity. Thus, the turbinates swell up and cause chronic symptoms of nasal obstruction, nasal discharge, headache and post-nasal discharge. treatment of chronic simple rhinitis is first treat the underlying cause, like for example sinusitis, DNS, etc., while its treatment includes nasal decongestants and sometimes antibiotics. Hypertrophic type of rhinitis, predisposing factors similar to the cause of chronic simple rhinitis lead to the development of hypertrophic rhinitis. Nasal obstruction and thick, sticky nasal discharge are the predominant symptoms. Sometimes headache and variable degrees of anosmia may also occur. Hypertrophy turbinates, especially the inferior turbinate, is a prominent feature of the disease. Talking about the treatment of hypertrophic type of rhinitis, first of all, one must treat the underlying cause. For example, sinusitis must be treated, and DNS, deviated nasal septum, must be corrected. And the other treatment for hypertrophic type of rhinitis is electrocautery to the inferior turbinates, submucosal diathermy, cryosurgery, and turbinectomy. Atrophic rhinitis. Atrophic rhinitis is a notorious disease and it's chronic nasal disease characterized by progressive atrophy of the mucosa and underlying turbinates forming dry crust and viscid secretions with characteristic foul odor. That is also called ozena. We can subdivide atrophic rhinitis into two, the primary type and the secondary type. Coming to the primary type, we've got certain factors. Nobody exactly knows about the cause of atrophic rhinitis, but people have postulated theories about its infection. And among that, the primary atrophic rhinitis, also called ozena, some people say that it is due to infection with Klebsiella ozeni or diphtheroid bacilli or Bacillus foetidus ozena, whereas some other people have got a hormonal imbalance theory. They say that at puberty, because there is some hormonal imbalance, one may get atrophic type of rhinitis, whereas because also it's more common in females. Nutritional type, some people say that it's due to vitamin A and D and iron deficiency that one may get atrophic type of rhinitis. And also because it's common in poor socio-economic status people. Hereditary may also play a part because more than one member of the same family may get this kind of disease. Whereas autoimmune, some people are in favor of autoimmune cause that certain proteins may also cause inside the body, may change and cause destruction in that way. Altered cellular reactivity, release of nasal, mucosal antigen into systemic circulation. Secondary type of atrophic rhinitis can occur due to a chronic rhinosinusitis, but it can also occur due to certain granulomatous lesions like tuberculosis, syphilis, and leprosy of the nose, whereas heroic surgery, sometimes taking out a lot of nasal turbinates, may cause secondary type of atrophic rhinitis, such as excessive destruction of nasal tissues. Now, clinical features of primary type of atrophic rhinitis, which is also called ozena, there is merciful anosmia. Why it's called merciful? Because the feature is so much so that no one near the patient can stand it. It's kind of stinks, and patient is like a social stigma. Whereas the thing is that patient himself or herself has got an anosmia, which is loss of sense of smell. She cannot smell her own fetid breath. Because of atrophy of nerve elements, this merciful anosmia occurs, and it is responsible for the anosmia. Now, second feature is nasal obstruction, which is, although the nasal cavities are very roomy, because there is atrophy of not only the nasal mucosa and glands, there is atrophy of the nasal turbinate bones, which gives a lot of room for breathing. But the problem with this atrophic rhinitis is that a lot of thick greenish color discharge dries up in the form of crusts and blocks the nose, and that causes nasal obstruction. Now, while bleeding from the nose, when the dry discharge or crusts are removed, then nasal cavities, when one examines them, are usually roomy, filled with dry, foul-smelling black or dark green crusts. There is septal perforation of the nasal vestibule. Nose may be deformed, like a saddle nose. Deformity may occur. Associated infections like pharyngitis, laryngitis, tonsillitis may also occur because of persistent discharge into the nasopharynx and the throat. Hearing may be impaired in these patients because of eustachian tube blockage, and there may be permanent impairment of taste as well. The crusts in atrophic type of rhinitis are often extensive. Removal of these crusts may induce bleeding. Once the crusts are removed, the mucosa is generally atrophic with elements of squamous metaplasia present. Treatment of primary type of atrophic rhinitis can be subdivided into medical and surgical. Medical measures include nasal irrigation using normal saline, then nasal irrigation and removal of crust using alkaline nasal dishes, and then one can use 25% glucose in glycerin in the form of drops to reduce the foul smell. Local antibiotics like chemicitin antizena solution, which is made up of chloramphenicol plus estradiol plus vitamin D2, may also be used. Estradiol spray, systemic streptomycin, rifampicin combination, oral potassium iodide, human placental extract may also be injected into the submucosa. Where surgical intervention, because medical treatment does not cure this disease at all. Whatever it does is just removes the crust and may lessen the stench and the fetor which is coming out of the nose, but it does not cure the disease. So people went after the treatment. What could be the possible surgical solution to that? And people have tried various methods, among which the most successful has been the Young's operation or the modified Young's operation. And what is Young's operation? What one does in this kind of operation, that one closes the nostrils with stitches just inside the vestibule of the nose for about 6 months. And people who have done this kind of surgery, they claim that when after 6 months of closure of the nasal cavities like that, when the nasal cavities are reopened, the nasal mucosa had reverted to normal. Now, apart from that kind of surgery, which is Young's operation, people have also tried narrowing of nasal cavities through submucosal injection of Teflon paste or section and medial placement, displacement of lateral wall of nose, transposition of parotid duct to maxillary sinus or nasal mucosa just to irrigate and prevent drying is also being tried. Now, narrowing of the nasal cavities, people have also tried by injecting certain materials into or submucosally into the inferior turbinates just to give some less room, because the nasal cavities, their theory is that the nasal cavities are roomy, and that's why the air gets more into the nasal cavities and dries up the secretions. If somebody narrows the nasal cavities, one may not get that kind of dried up secretions which occur in the form of crusts. Thank you very much.